Hi, Bruno here. Welcome to Spainguru.
Today we're going to talk about the Tarjeta Comunitaria or community card and which are the economic means and health insurance requirements to obtain it. The residence card for family members of EU citizens has become one of the most processed and managed cards by the immigration offices nowadays. Therefore, it is very common to come across questions and doubts regarding the requirements, documentations, and application for the well-known community card or Tarjeta Comunitaria. What are the requirements for the community card? In order to obtain the community card, it is essential to fulfill a set of requirements. These requirements include having a connection with a Spanish or EU citizen. Regarding the management of the community card, if you have a connection with a Spanish citizen, you should take into account that certain family members of Spaniards have been included in the concept of family roots after the reform of the immigration regulations in the summer of 2022. Number 2. Living together with a Spanish or EU citizen. Number 3. Having economic means. Number 4. Having guaranteed healthcare in Spain. And in certain cases, providing evidence that the family members, such as parents or children over 21 years old, are dependent on the Spanish or EU citizen. The main focus of this article revolves around two essential aspects of the community card or Tarjeta Comunitaria: healthcare provision and the verification of financial resources. Let's go with the economic means for the community card. One of the primary prerequisites for obtaining the community card in Spain is to demonstrate economic stability or sufficient financial means. This requirement holds significant importance and has emerged as a leading cause for card denials in the country. In this regard, Royal Decree 240 of year 2007 from February 16th clearly establishes how a Spanish or EU citizen can demonstrate their economic means. First one, being an employee in Spain. The second one, being self-employed in Spain. Third one, having sufficient economic resources for themselves and their family members to not become a burden on the social assistance of Spain during their period of residence. They must also provide a public or private health insurance policy contracted in Spain or in another country that provides coverage in Spain equivalent to that provided by the national health system. The assessment of sufficient economic means will be carried out on an individual basis, taking into account the personal and family situation of the applicant. Having resources exceeding the amount determined each year by the Presupuesto General del Estado, or you could translate it as the General State Budget law, to qualify for a non-contributory benefit will be considered sufficient proof to meet this requirement. And last one, being a student enrolled in a recognized or government-funded public or private educational institution to studies or vocational training, and having a public or private health insurance policy in Spain or another country that provides comprehensive coverage in Spain, the student must also make a responsible declaration stating that they have a sufficient economic resources for themselves and their family members to not become a burden on the social assistance of Spain during their period of residence. It is worth emphasizing that there are no specific requirements regarding employment duration, salary threshold, or tenure with a particular company. The key factor is to provide evidence that at the time of applying for the community card, you are registered with Social Security if employed or self-employed, possess sufficient financial resources, or are a student. Health insurance and the community card. Another important aspect to emphasize regarding the residence card for family members of EU citizens is the requirement for health insurance. In addition to demonstrating the economic means of your EU or Spanish family member, it is essential to provide proof of healthcare coverage as a family member. In this regard, you can provide evidence in two ways. One, by utilizing a public healthcare insurance card, and two, by opting for private health insurance. If you decide to go with private health insurance, it is essential that the policy provides comprehensive coverage without any co-payments or waiting periods. In essence, you must demonstrate that the coverage offered by your private health insurance policy is equivalent to that of a public healthcare insurance card. Let's dive deeper into each of these requirements. There are three requirements. full coverage, no copayments, and no waiting periods. The first one, full coverage. The private health insurance policy must provide comprehensive coverage encompassing a wide range of medical services and treatments. No copayments. The insurance policy should not involve any copayments, which are additional payments required at the time of receiving medical services. And finally, no waiting periods. There should be no waiting periods associated with the insurance policy. This means that coverage should be effective immediately upon obtaining the policy without any waiting period for accessing healthcare services. Meeting these requirements ensures that private health insurance policy is considered valid for the purpose of fulfilling the health insurance requirement for the community card application in Spain. In Spain, there are numerous companies and insurers that can offer you the aforementioned health insurance. It is important to ensure that it will be valid for your applications for the residence card for family members of EU citizens. You can obtain your fully compliant health insurance for your community card here on Spainguru.es, completely online and with all the necessary documents in maximum 2 working days. Just go to the top menu of the page and you will find the link Family Members of Spanish Citizens. It is important to clarify that certain family members of Spanish citizens must currently apply for family roots or arraigo familiar. With the implementation of the immigration regulation reform on August 16, 2022, specific family members have been included under the immigration regulation, specifically within the concept of family roots or arraigo familiar. Therefore, if you are any of these family members, you must apply for arraigo familiar. There are 3 cases. The first one, spouse or registered partner of a Spanish national. The second one, ascendants over 65 years of age or under 65 of age, dependent on others. And the third case, descendants under 21 years of age or over 21 years of age, dependent on others, of a Spanish national or their spouse or registered partner. In this case, a residence permit for exceptional circumstances, arraigo familiar or family roots in English, will be granted, which has a duration of 5 years and allows both employed and self-employed work. On the other hand, if you are a family member of a Spanish citizen but do not fall within these categories, such as sibling, grandchild, grandparent, etc., you will need to apply for a residence card for family members of EU citizens through the concept of extended family. These family members are not covered by the arraigo familiar or family roots category, and therefore it is necessary to continue managing this community card under Article 2 bis of Royal Decree 240 of year 2007 of February 16. In conclusion, the community card or Tarjeta Comunitaria is a highly sought after residence card in Spain, requiring fulfillment of specific requirements. The 2 key pillars of this card are economic means and health insurance. Economic means can be demonstrated through employment, self-employment, or sufficient financial resources. Health insurance can be proven with either a public health insurance card or private health insurance with comprehensive coverage. It is crucial to ensure that the chosen health insurance meets the criteria for the application. Certain family members of Spanish citizens may need to apply for family roots or arraigo familiar, while others fall under the extended family category for the residence card for family members of EU citizens. Understanding these requirements and following the appropriate procedures is essential for obtaining the desired residency status in Spain.
You can become part of our Spainguru community today by joining our Facebook groups. Our most important group is the Spain Immigration and Residency Questions group, with over 17,000 members. We also have dedicated groups for Spanish non-lucrative visas with more than 2,300 members, and for the Spanish Digital Nomad Visa with 2,000 members. And if you need expert professional advice, we've got you covered. Just head to Spainguru.es and check out our top menu. You'll find immigration experts, relocation agencies, tax advisors for Spanish and US filings, sworn translators, apostille services, and health insurance providers for all types of Spanish visa applications and renewals. That includes non-lucrative visas, golden visas, student visas, and digital nomad visas, as well as medical certificates for visa applications and travel insurances. Finally, I highly recommend you join our weekly newsletter, which we send out every single Monday morning. You'll get tons of information, questions and answers, featured blog posts, and even news updates. Thanks again for watching, and we'll see you in our next video.